Hi, today we are glad to have Dr. Ryan Lee from Thomson Specialists to talk with us about menstrual disorders. Thank you for joining us, Dr. Ryan Lee.
Thanks, Kelly. It's great to be here.
What exactly is a menstrual disorder?
So, menstrual disorders are actually problems for the menstrual cycle, and they vary within various women, and it encompasses a variety of signs and symptoms.
So what are the common symptoms of menstrual disorders?
So, you could range from having heavy bleeding, changing 3 pads a day for more than 3 days, to having painful menstruation lasting more than 3 days or outside of the menstrual cycle. And thirdly, irregular periods or lack of periods. For example, having no menses for 1 to 3 months.
So to what extent is normal for discomfort, and to when does it cross over to disorder? So of course, fainting, like we mentioned, is not normal. Changing more than 3 pads a day is not normal as well. So what else should we take note?
So actually, 1 in 3 women actually do have heavy periods lasting more than 3 days, changing more than 3 pads a day for more than 3 days.
Which is not normal.
Which is not normal, yes. So it's actually a very common problem, but underreported as well. So in this group of women, they may complain of feeling faint, or may complain of feeling tired and giddy because they lose excessive amount of blood. That's when they do feel that they need to see a doctor early to see why they're losing so much blood. Secondly, also in this group of women as well, who are thinking about, either starting a family soon or just to go about their daily health checkup. They may find that if they have any menstrual problems, either the menses is too heavy, too painful, too much, or on the other extreme end, absence of menstruation, where they do not ovulate or have regular periods, then that could be a problem as well. Especially, there's another group of women with polycystic ovarian syndrome, or PCOS in short. They actually do have irregular periods. And in this group of women, they do not ovulate frequently, and hence they have very little menses or absence of menstruation. They're actually at risk of other medical problems as well, such as at risk of having diabetes or even precancerous changes of the womb later on in life, which is why it's important to diagnose this condition early and to seek help early as well, because there's treatment available.
So how can having menstrual disorders affect a woman's future in terms of reproductive health or sexual health?
So a menstrual cycle is important because it allows you to time and plan for fertility. So in women with irregular menses, they may find it difficult to get pregnant because they do not know when is their window period or fertile period. Or on the other hand, women with abnormal menses like heavy bleeding or excessive bleeding may be at the risk of having problems like endometrial or womb cancer, which they also need to address this problem early.
So are there ways to actually address these symptoms?
So first of all, they should seek help early and see their gynecologist early, who will take a medical history, do a relevant examination, and perform a pelvic ultrasound. And depending on the type, gynecologist may order certain tests, like a blood test, for example, to look for any hormonal disturbances such as thyroid problems, or even do endometrial biopsy to evaluate and exclude endometrial cancer.
For young ladies especially, or for teenage girls who are just beginning to have their menstruation, how important it is for them to take note of these symptoms or to know about the existence of menstrual disorders, and what should they do about it?
So for young women, especially in young teenagers who are just undergoing puberty, their menstrual cycle may be different from adults. For example, it may be irregular or heavier, or they may have abnormal spotting, and they can also sometimes feel a bit confused and may not want to tell their parents or see a doctor early. Hence, it's important for them to know that there is help available. And also for women who are of reproductive age, for example, in their adulthood, these menstrual disorders or problems can also affect their fertility as well, especially if they're trying to start a family and if they have irregular periods or excessive heavy periods, then that may be a problem when they're trying to get pregnant. And women should be aware that their menstrual cycle is indeed important and part of their own reproductive health, and as part of their own healthy living as well. So they should actually be more active in terms of seeking medical help if they have any problems.
So, thank you so much, Dr. Lee, for such a meaningful session today. We really appreciate it.
Thank you for inviting me here today.